by actually being very factual. The reason I talked about 48,000 population on record today as being or bearing the burden of cancer, 33,000 or thereabout dying annually out of cancer and cancer-related complications, is to actually confirm to you there's a problem. And that is why the problem will need to be two things. One, have the right messaging to bring down, if you will, the levels of anxiety by saying a responsible government does not sit to wait for a problem. A responsible government plans, intervenes, and assures Kenyans that we are doing everything that we possibly can do in the immediate term, in the short term, and in the long term. I went ahead to paint the status, as it were, of now. The status is that, like the chairperson confirms, there is an information asymmetry. There is anxiety, but there is also reality that people are affected, people are sick. I went ahead to indicate that although we have made substantial infrastructural investment in the chemotherapy centers, 7 of them, 3 to go, so that we have 10 as we start. We also have invested in radiotherapy centers, 3 of them ready for functioning end of the year. I went ahead to say that we have invested in managed equipment service in 98 county. Every county has mammography, for example. We have invested in CT scan for better diagnosis. And therefore, I did not shy away from saying, yes, there's a problem. But yes, we have intervened in a certain way. Do we need to intervene more? Completely yes. We must intervene more. Do we need to coordinate better? Completely yes. And that is why this board comes in, so that we can be able to coordinate the interventions by the private, by the civil society, by yourselves, the media, by ourselves at the policy level, by them in terms of intensifying awareness raising. Not awareness so that you know. While that is important, is awareness so that we call you to action in terms of changing in your lifestyle. If you are obese out of not being actively engaged, for heaven's sake, don't use the boda when you're covering half a kilometer. Walk. It's good for you. It's good for your heart. It's good for your propensity to be exposed to cancer. Lifestyle change, so that again, like Sikoli would tell us, if for any reason you suspect the food that you're taking is out of a sewage farm, please avoid it at all means. And I have seen Kenyans in the last 2 weeks actually move out even in restaurants and want to find out what is the source of this meat, what is the source of this, what is the source of the other. That is what a lifestyle change campaign will do for us. At the end of the day, we'll be able to ask and hold the people giving us what we put in our mouth accountable. Really, you raise the issue of resources being available. As you will know, money will never be enough. The question of Kenyatta National Hospital raising resources to construct what we call the Hope Center is a palliative center for people who are completely at that end, out of cancer, and having carried the burden for them, and wanting for us as government to support the homes who are struggling with the long-term care. Hence, partners have come together and they have told Kenyatta, if we fundraise jointly, we are also going to invest with yourselves, so that we have a national palliative center for these people who may be in need and vulnerable and require that close attention. And I think it's a good thing. You should support that. It does not come to say that money is not being availed. Like I indicated, budgets are being appropriated, but the needs are equally many, given what it is we are addressing today. As to whether this should, at this point, be declared a national disaster, clearly we've sat with this, my team, my colleagues, we've sat with colleagues in the sector, This week and before this week, we've sat before Parliament, the National Assembly Committee responsible for health, and this conversation has been brought to us more than 1 year ago. I do not want to appear to be not sensitive. I'm very sensitive right now, the season we are going through. For us to be able to reach a point of declaring this a national disaster, there has to be sufficient data built over time, and that is desegregated. That is also indicating the causes. That is scientific, that is solid, that is sound. For us then to be able to actually come to a place and advise His Excellency the President, only he can declare a national disaster. We would be doing that once we get to that stage. For the time being, between now and that time, there is work to be done. And this is a conversation I want us to expose Kenyans to, beyond what has been happening. It's been emotive, I understand. Can we now bring the facts and avail them to us? Tomorrow morning, we will be having a workshop between the experts. The DG is going to lead us on that, and the oncologists are going to be, and the chairperson will be present, so that we also move away now from the issue of high emotions because of lack of information. And we begin then to actually interrogate the information that we have available a little bit further, dissect it a little bit further, and we have the experts speak to the population. I think that is going to be useful even before now we focus on these other longer term reactions. Enoch, you talk about the issue of experts and oncologists in this case, and I've spent a lot of time with them this week. And I've spent a lot of times as well moving through the chemotherapy centers in the country, as well as the oncology center in Kenyatta here. We have talked about UHC being successful and sustainable only if it is based on the basics. And my colleagues, the oncologists, are actually just confirming the same. Sustained and impactful healthcare delivery isn't going to be at the point where it's either preventative when you're already at stage 4, very sick, or when we are taking you to palliative care. We will be able to salvage a life and many more if we start with the basics. Lifestyle issues, we speak about. Environmental issues, we speak about. Issues of diet, we speak about. Very, very basic issues touching on health education, health promotion, health prevention. And that is the basics we are looking at. And we all seem to agree. Hence the conversation that this team will be coordinating or leading us by way of coordination. The issue of the basics again touch on you, an ordinary citizen, appreciating you have perhaps 50% of the responsibility in averting what we are dealing with today. Knowing that for the women, for example, you did not even require the mammography. Yes, in advanced cases you require the mammography test, but very basic physical test of your breast, for example, will suggest something feels abnormal, and you'll then be able to go to a health center to validate. Very, very basic issues. Cough blood is not your usual normal cough. Go to the toilet, there's stool, and it is stained. It is not normal. It is very basic. And that is what we must take to us, the ordinary people. So that even as you're filtering going to the facility, really you become your own expert in terms of feeling something is not very right. For the ladies, in terms of the cervical cancer, which is a leading, one of the leading, again, we are saying at level 3, it is possible you can actually get screening done. We have sufficient level 3 facilities, as it were. As to whether we have sufficient HR to deal with this, I did expose the figures. Today we have 35 oncologists, trained doctors, finished, complete, back home. We have 36 oncology nurses, trained, finished, experienced. We have about 10 clinical officers who are oncologists, trained, finished, back and working. The intervention that we'll be taking is the following. This pool, which is really the cream in terms of cancer management, will be getting into a place, and some of them already are getting into a place where they are rotating around the chemotherapy, the hospitals with the chemotherapy centers. And they will, in the process of giving service, also mentoring the colleagues in these facilities. They will also be part of our resource that is going to be leading on the awareness campaigns. So again, there are gaps. We are being strategic. We are being smart in terms of how we approach this whole thing, given that it will take also a bit of time. We have 20 oncologists currently in training, in training. Again, it's a resource that will come into market very, very quickly. The reason we go out sometimes and look for experts from out of the country is because of that gap. And a part of what Kenyatta University will be doing is also partnering and bringing in, through fellowships and other arrangements, experts, oncologists, radiotherapists, so that we minimize the gap. Gloria, chemotherapy is killing patients, is what you have. I perhaps will not wish to comment directly on that, but I wish to refer you to the response which I've just made, that indeed, aware that we do not have a lot of experts in this area, through mentoring, through rotation, and through availing themselves on a rotation basis in the counties, then we actually are covering the people that we need to cover. Thank you.